Hey folks, ever get that nagging feeling that something's off with someone you love? Maybe your grandma, your dad, or that super spry neighbor who suddenly isn't quite so spry anymore? We're not talking major meltdowns here, but those subtle little shifts that make you wonder. You know, the way they're suddenly losing weight without trying, or how they just seem tired, like bone tired all the time. Thing is, we're often told that old age brings about sudden deaths, which can be alarming for family and friends. But the truth is, the body is usually kind enough to send out subtle warnings, quiet little messages, months or sometimes even a year before it's time to say goodbye. And here's the kicker. Most of us totally miss them. We chalk it up to just getting older, right? We brush it under the rug. It's only later, when we're looking back, that we realize those clues were there all along. But by then, it's too late. Too late to really prepare, to have those meaningful conversations, to make those last memories truly count. That's what this video is all about. We're diving into 5 key signs that often pop up a year or so before an elderly person passes away. Seriously, these are the things you need to know. Some of them might be stuff you've already noticed but brushed off, while others might seem like minor changes, but actually signal that the body's slowly winding down. Recognizing these signs early, it's a game changer. It gives you the chance to provide better care, to truly cherish those meaningful moments, and most importantly, to make sure your loved one's final chapter is filled with comfort, dignity, and peace. Stick around until the end, because these 5 signs can help you prepare emotionally and practically for what's ahead. Understanding what's happening empowers you. It means you won't be caught completely off guard, and you'll be able to make the absolute most of the time you have left with those you love most. But before we jump in, I've got a quick favor to ask. If you're new here, hit that subscribe button and ring the notification bell so you don't miss any of our videos. And if you're already part of the family, drop a comment below and let us know what you're hoping to learn today. Your support means the world, and it helps us keep creating content that matters. All right, let's get started. Sign number 1, significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintentional weight loss. At first, it might seem subtle, a belt that suddenly needs tightening, clothes that appear looser, or a hearty appetite that begins to fade. Many families dismiss it as just part of getting older, but the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too quickly, it's a sign that something deeper is occurring. The body may be struggling to digest food properly, or the person may no longer be able to process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement more difficult. It increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Another reason for weight loss in the final year of life is appetite changes. Many elderly individuals simply don't feel hungry the way they used to. Their sense of taste fades, food no longer seems enjoyable, and they might start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological change. The body, sensing that it's beginning to shut down, no longer signals the brain to seek food as often. The result is less energy, less strength, and a gradual decline in overall health. Underlying medical conditions also play a significant role in weight loss. It's a common symptom of chronic diseases like cancer, heart failure, or kidney disease, all of which can begin progressing long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to reduced eating, causing a downward spiral where the body isn't receiving enough fuel to sustain itself. Some families try to solve the problem by encouraging their loved ones to eat more, offering favorite foods, or supplementing meals with protein drinks. However, if the weight continues to drop despite these efforts, it's essential to recognize that the issue is not just about diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, Especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This is not just about physical appearance, it's about the body sending a message. Understanding that message now can help you prepare for the road ahead with clarity, compassion, and the ability to make every remaining moment meaningful. As we explore these signs, it's crucial to remember that each one is a part of a larger narrative, a story of life's final chapter. Recognizing these changes early can empower you to provide better care, cherish meaningful moments, and ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. So let's continue this journey together, understanding each sign as a piece of a puzzle that helps us navigate the complexities of life's end with grace and compassion. Sign number 2, extreme fatigue and weakness. If you've noticed your loved one seems to have an endless case of the blahs, you may be seeing one of the telltale signals of a deeper change, extreme fatigue and weakness. We're not just talking about feeling a little tuckered out after a busy day. This is a persistent, all-encompassing exhaustion that refuses to lift, no matter how much rest they get. It's a weariness that seeps into their bones, turning even the simplest tasks into monumental challenges. What differentiates this from normal tiredness is its relentlessness. While a healthy person might bounce back after a good night's sleep, someone experiencing end-of-life fatigue will continue to feel drained, even after days of rest. They might struggle to get out of bed in the morning, find walking across the room an immense effort, or feel too exhausted to engage in activities they once enjoyed. This isn't just physical, it's a deep-seated weariness that affects their entire being. At the heart of this fatigue is the body's strategy for conserving energy. As organ functions begin to slow down, the body prioritizes essential processes, diverting energy away from non-critical activities. The heart, for example, may not pump blood as efficiently, leading to reduced circulation and oxygen delivery to the muscles. This can leave a person feeling weak, unsteady, and unable to sustain activity for long periods. Adding to the problem is metabolic slowdown. The body's metabolism, responsible for converting food into energy, also begins to decline, and the body shifts toward preservation. This means that instead of fueling movement, the body focuses on maintaining vital functions, often at the expense of physical strength. This is why many elderly individuals start sleeping more, needing longer naps, and finding it difficult to stay awake for extended periods. But here's the unexpected twist. This fatigue can be deceptive. One moment, they might seem relatively fine, engaging in conversation or watching TV. The next, they're completely drained, unable to continue the activity. These sudden energy drops can be unpredictable and unsettling, leaving both the individual and their caregivers feeling confused and frustrated. Perhaps the most heartbreaking aspect of this fatigue is its emotional impact. Many seniors who once prided themselves on their independence feel frustrated, embarrassed, or even ashamed that they can no longer do the things they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply lack the energy. This can lead to a vicious cycle of isolation, where the person becomes less active, which in turn further weakens their body and mind. It's easy for family members to misinterpret this behavior as laziness or stubbornness, but the reality is that forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you observe deep, ongoing fatigue in a loved one, which rest doesn't alleviate, recognize it as a signal. It's an indication their body is going through a substantial transition and may be approaching the last year of their life. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, what matters isn't how much they can do, but that they feel loved, understood, and at ease, setting the stage for peace in their final days. Sign 3. Increased cognitive confusion or withdrawal. One of the most poignant shifts you might witness in the final year of someone's life is a noticeable change in their cognitive abilities and social engagement. This can manifest as increased confusion, forgetfulness, or a withdrawal from activities and interactions they once cherished. It's more than just a senior moment, it's a persistent pattern that indicates a deeper transition. Cognitively, you may observe that a once sharp and engaged mind begins to falter. They might struggle to recall recent events, repeat themselves frequently, or have difficulty following conversations. Familiar places might become disorienting, and they may struggle to recognize faces or names that were once easily recalled. This isn't simple forgetfulness. It's the brain struggling to maintain its usual level of function. One of the underlying causes is reduced blood flow to the brain. As circulation weakens, the brain receives less oxygen and fewer nutrients, impacting cognitive function. This can lead to periods of lucidity interspersed with moments of confusion, almost as if their mind is flickering. Decisions become difficult, and tasks that once seemed simple now require significant effort and concentration. Beyond cognitive changes, emotional withdrawal is another significant sign. The person may lose interest in social interactions, preferring solitude and silence. They might stop participating in conversations, attending social events, or engaging in hobbies they once enjoyed. This isn't necessarily a sign of unhappiness. It's often the result of the brain prioritizing essential functions over social engagement. Processing emotions and interacting with others can become tiring, leading them to retreat into their own world. Mood and behavior changes may also become apparent. Some individuals may become more irritable, anxious, or easily frustrated, while others might seem unusually calm, detached, or indifferent. These aren't simply personality shifts. They're often the result of the brain adjusting to the body's decline. As cognitive function slows, emotional expression becomes difficult, leading to changes in their usual demeanor. For families, witnessing these changes can be particularly challenging. It can feel as though you're losing your loved one piece by piece as they become less connected to the world around them. It's crucial to remember that these changes aren't intentional. They aren't something the person can control. The most supportive approach is to meet them where they are, offering patience, understanding, and reassurance. Creating a calm, safe, and familiar environment can be incredibly beneficial. Reduce stimulation, avoid noisy or overwhelming situations, and focus on providing comfort and security. Reminiscing about positive memories, playing familiar music, or simply holding their hand can provide a sense of connection and comfort, even when words fail. If you're noticing increasing forgetfulness, confusion, or social withdrawal in a loved one, don't dismiss it as simply getting old. These are often early indicators that the body and mind are preparing for the final transition, signaling an opportunity for empathy and support. It is a time to cherish quiet moments and prioritize creating an environment filled with love, peace, and understanding. Offering solace when words fade and connection remains key. Sign number 4, frequent infections and slow healing. As the body ages, one of the most concerning signs that it is entering its final stages is a weakened immune system. This results in frequent infections and a noticeable delay in the healing process, often going unnoticed by families who think it's just a part of getting older. However, these infections aren't just minor issues. They're important signals from the body that something more serious is happening beneath the surface. At first, it might seem like your loved one catches every cold, flu, or bug that comes their way. What once might have been a minor illness now lingers far longer than it should. Small cuts or bruises that would have healed quickly before now seem to take forever to recover. The body's ability to fight infections diminishes as circulation slows, leaving your loved one more vulnerable to infections like pneumonia, urinary tract infections, UTIs, or skin conditions. Even common oral infections can become persistent and harder to manage. But what makes these infections particularly dangerous is that they don't always show typical symptoms. You may not see the fever, chills, or classic signs of illness that you'd expect. Instead, your loved one might simply appear more tired than usual, more confused, or less interested in eating. This subtle decline in alertness can be one of the first signs that the body is struggling to fight off an infection. For families, it can be easy to overlook or misinterpret these symptoms, thinking they're just part of aging. But it's important to pay close attention to the change in behavior. Another sign of this weakening process is slow wound healing. A minor scrape or small wound may take weeks to heal or never seem to fully recover. This happens because blood flow is restricted, meaning oxygen and essential nutrients aren't reaching the wound as effectively as before. For those who are less mobile, Pressure sores can also develop and become more difficult to treat. If left untreated, these can lead to serious infections. For families, watching a loved one battle repeated infections and slow healing can be difficult and frustrating. It's natural to want to push for more treatments, hoping that another round of antibiotics or a longer hospital stay will solve the issue. But sometimes aggressive treatments only prolong suffering and don't address the root cause, the body's natural decline. At this point, the focus should shift from trying to cure the illness to providing comfort. Keeping the person hydrated, ensuring their skin is moisturized, and minimizing physical strain can often be more effective than continuing to seek medical interventions. The goal is to make their final days as comfortable and dignified as possible. Recognizing frequent infections and slow healing as signs of a deeper issue can help you prepare emotionally for what's ahead. It's not about stopping the inevitable, but about ensuring that your loved one's final months or weeks are filled with peace and comfort. By understanding these changes early, you can adjust your care and offer them the support they need in this challenging phase of life. Sign 5. Major changes in breathing or circulation. One of the most observable signs that a significant transition is taking place involves noticeable alterations in breathing patterns or circulation. This goes beyond simple breathlessness after activity. It's a deeper change in how the body sustains itself, potentially involving subtle shifts in breath rhythm, noticeable color variations in extremities, or an overall sense that the body is starting to slow down. A common sign is a change in breathing. Your loved one may breathe more shallowly or slowly. They might pause between breaths, or the rhythm could become irregular, speeding up and slowing down unexpectedly. Some experience these Cheney-Stokes respiration, a rhythmic pattern alternating between deep, rapid breaths and apnea. Although potentially alarming, it's often a natural part of the body's final processes. Changes in circulation also offer important clues. Hands, feet, or even the nose and ears may feel cold to the touch. Skin might appear pale, mottled, or even bluish, especially on fingers and toes. This occurs as the body prioritizes blood flow to vital organs, reducing circulation to the extremities to conserve energy. It's a sign that the heart's pumping less strongly and the body's redistributing resources strategically. Beyond these obvious changes, more subtle shifts may occur. Some may experience increased shortness of breath, even with minimal activity. Simply sitting, speaking, or shifting positions might lead to breathlessness. They may breathe through their mouth more often or need to stop mid-sentence to catch their breath. Once able to walk easily, they might now struggle, signaling declining lung function not otherwise evident. Fluid buildup in the lungs can further complicate breathing. This can cause a persistent cough, gurgling sounds, or a feeling of chest tightness. Often mistaken for a cold, it's often a sign of weakening lungs and fluid accumulation due to reduced cardiac efficiency. This can make lying flat uncomfortable, leading them to sleep propped up to ease breathing. It's essential to understand the potential disconnect between appearance and experience. Though breathing is labored or extremities are cold, they may not complain of pain or discomfort. Their perception of these changes might be dulled, complicating accurate assessment of distress. Rely on observations and intuition, offering support even without explicit requests. These visible changes can be alarming for family members with a natural urge to help, but often this is simply the body's natural slowing. While reversing changes may not be possible, comfort is achievable. Keep the room cool, use a humidifier, or offer small sips of water. While medications or oxygen therapy may provide relief, the focus should shift to comfort rather than attempting to fix the issue. So if you observe alterations in breathing patterns, cold extremities, or a bluish tint, be attentive. These often indicate that the body is conserving energy and circulation is slowing. More than anything, ensure a calm, peaceful environment, offering comfort and support. It's in these moments that love and presence are paramount as the body gradually prepares for rest, highlighting the importance of understanding to provide better care for your loved ones. We hope this video has shed light on some important signs to watch for in your loved ones. Recognizing these changes isn't about fear, but about preparation. It's about empowering you to provide the best possible care, create cherished moments, and ensure comfort and dignity during life's final chapter. If you found this video valuable, please give it a thumbs up. Your support helps us reach more people who need this information. And now for the most important part, subscribe to our channel. By subscribing and hitting the notification bell, you'll never miss our latest videos on senior care, end-of-life planning, and creating meaningful connections with your loved ones. We're here to provide you with practical advice, emotional support, and a community of caring individuals. Don't forget to leave a comment below, sharing your thoughts, experiences, or any questions you might have. We read every comment and appreciate your engagement. Thank you for joining us on this journey, and remember, you're not alone.